Hello, my name is Daniella, and I'm a speech-language pathologist at Toronto Rehab. In this video, I will talk about some ideas on how to conduct a clinical swallow assessment virtually. Some important considerations prior to conducting a swallow assessment are reviewing emergency procedures before the swallowing assessment. This includes patient's emergency contact and letting the patient know that you would call 911 if need be. Make sure the patient has sensory aids in place, for example, glasses, hearing aids, and dentures. Have a family member present if possible, or arrange for an interpreter if the person is unable to communicate in English. Ensure the patient's seating and positioning is optimized. Ensure the patient's mouth and throat can be seen easily. Use utensils and a clear glass or cup for ease of visualization. Have food ready and prepared ahead of time. Hi John, I hope you're doing well. We are monitoring how you're doing with swallowing drinks at home. You mentioned some difficulty when drinking from a cup. You also mentioned having trouble chewing some foods. For today, I asked if you could have some water, a clear cup, and a teaspoon ready.
Yes.
Before the assessment, the patient and family were provided with instructions on having specific items needed for the trial. For example, a clear glass or cup to allow for better viewing of the food or liquid. We want to ensure you are able to sit upright in your chair before we start the assessment. It's nice to see that your partner has joined us today. It is important to sit in an upright position during meals to avoid choking hazards. Having a family member present is important for safety and for education purposes. If the patient is alone and demonstrating significant difficulties with swallowing, for example choking, the clinician should call 911. It is also important to ensure that you have emergency contact information on hand at each session. Before we begin the swallow trials, I want to ask if you're wearing your dentures today.
Yes, I have them in.
Next, I would like to ask if you could undo the top button of your shirt so that your neck is visible for the assessment. To start with, I would like you to take a teaspoon of water. Great, now please take one sip of water from the cup. Please take another sip of water from the cup. The speech-language pathologist notes the timing and number of swallows by looking at the movement of the larynx, or Adam's apple, and safety of the swallow, for example, choking, coughing, throat clearing, and changes in voice quality. We would then continue to assess the patient with other food and liquid textures. Since the patient exhibited coughing with liquids and a slow swallow reflex, the speech-language pathologist would likely recommend that the patient come in for an in-person swallow assessment. At that time, the speech-language pathologist would then determine if the patient required a more detailed video swallow study, such as a swallow X-ray. Following the assessment, the patient and family are provided with assessment results, verbal or written education, and swallowing recommendations. Education from this scenario might include taking water from a teaspoon only and not from the cup, while the patient waits for the in-person assessment. Thanks so much for watching this video on how to assess swallowing virtually.